This is The Changed Physician, episode 196. Welcome back to The Changed Physician. I am Melissa Cady, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro, and we're here to do a deep dive discussion about Paul Thomas's book, Dressing Well in Medicine. If you missed those episodes, go back to episode 194 and 195. It's a two-part series of almost, believe it or not, almost an hour conversation of what seems like not a very important topic, but we found out there was a rabbit hole that we went deep into. Any comments about that, Kevin?
Yeah, I mean, because we discussed that, and I actually told Paul before we started, I think, I was curious how you write an almost 300-page book on dressing well in medicine and the reasons why he did it. And it is so much more than simply dressing well in medicine.
Mm-hmm.
And it was an awesome discussion, because I love those where you start on a thing and you kind of think but you're like, oh, okay, whatever, and then it just evolves into this really interesting idea about how our profession is presented, how our profession is perceived, blurring the lines in professional scenarios, different dress tips in the hospital and how important those are. I mean, we literally could have done an entire episode on the whole white coat thing, which someone listening may think this is just stupid, but it's a big deal. And a little bit off air, I talked about, like, when I was a medical student, and medical students are traditionally identified by your short white coat. I would actually use long white coats to identify who the attendings were. That was important to me in these clinical scenarios. And when it gets blurred like that and you can't find who you need, that's an issue. And that's something that should be of concern of people. If you're in the hospital and you don't know who's taking care of you or who's coming to your bedside and where they are in that professional relationship with you, that's unfair to you. And it prevents and I would wager in a lot of ways an unsafe environment. And certainly an uncomfortable environment that it doesn't need to be there if we are dressing appropriately. And so Paul, we kind of discussed that a little bit as well, but there was so much more than just that, where we were looking at the interview process. As a medical student, you're thinking about interviewing for residencies, which is another huge big hurdle, what you present in your day-to-day practice. So this was I literally, I don't know how we're going to have a lot to talk about, and we could probably talk for another hour on these things. So I thought it was, I just love these types of episodes. Surprising ones.
Yeah, and it's so deep rooted in just symbolism and culture, tradition, and you're talking about how there's that blurring of lines, and for the most part, I mean, there are some patients that actually, because they're so confused, they're so worried about offending someone too. There's that side. They just call everyone doctor because they're not sure which one really is the doctor. I've seen that happen. But I think
the issue there, I'm just going to want to jump in there. Yeah, that wouldn't necessarily even be a big issue if everybody corrected them and just say, this, no, I'm this, no, I'm that. Yeah. But they don't.
Yeah. And that's the element, though, that is you have to be very careful, and it's weird. We've talked about this in a previous episode where, I remember Ali Abdul, I think it was Abdul. Yeah. He was interviewed, and he doesn't, in the UK, enforcing this doctor so-and-so is frowned upon, as if the ego is trying to, push their, whatever you want to say, authority or something on other people. And so that's an interesting conversation. And I do find myself challenged by that. If someone doesn't respect the title, even though they know I'm a physician, or maybe they don't, they think maybe an anesthesiologist is not a physician. That's confusing in and of itself, because there's other people that help with delivering anesthesia. But I think there was something I wanted to get to. There's so many, just goes to show you how many tangents you can take this. But there are so many points that you don't, it's like you feel like I'm troubled sometimes with how far to take it, how far as a female physician when they constantly want to tell you or call you by your first name, when to draw that line. And I guess it depends how they're treating you, whatnot. But the dilemma is if there is not a strict boundary placed, like you said, or an obvious symbol of who people are, there's a lot of confusion that arises. And the thing that I wanted to say is that there are some people, unfortunately, as humans, we want to feel the sense of authority or feel the respect that physicians have, even if they haven't acquired that title. And so I think we get into trouble when we don't demand some kind of boundary, not because, oh, we're so much better than you, but this is earnestly earned as this title, whatever, in our particular profession, in this particular culture. And I think it's very disrespectful to physicians to enable all these other people to basically feel like they're a physician when they're not. Doesn't mean they're not important. And that's where confusion arises too. But any thoughts on that?
I would just say it's a question of honesty is really what it comes down to. And truth is a huge, big deal to me. If there's any sort of central value to me, it's probably truth. And the core of any of this, like this is not necessarily on the dressing medicine part, but identifying who you are and where you stand in a care team is a matter of professional and intellectual honesty. And people do this mental masturbation and try to do all this stuff, but the case, if you're being dishonest and you're appropriating a term that is not yours, then you're basically a fraud. And there's that Nassim Taleb's quote. This is basically, if you see fraud and you don't say fraud, then you are a fraud. And so I feel very strongly about that. And like, if you are, whatever your profession is, take pride in your profession, identify as such. If you are not, that's a problem with you. Not, and it's not appropriate to do something else. But
yeah.
So that was one part of that interview. It was just one little piece that
one tiny sliver.
Yeah, one could have gone off on the other side. But the other thing that you brought up that is really important is this also had the potential to be a very loaded interview, because people in this day and age, and people are like, well, I want to identify, I'm who I am, and people should just love me for who I am. First of all, you need to love whoever you are. That's the most key thing, and not necessarily rely on people's external perceptions of you. But the other part about that is when you're in a professional session or setting, first impressions matter. It doesn't have anything to do with your feels, has nothing to do with subjectivity or what's right or wrong or anything. There's actual measurable research studies that demonstrate that how you are perceived on that first visit impacts how you are perceived longitudinally over time. And it is extraordinarily difficult to overcome those first perceptions. There's a book that's not dressing well, but it's by Heidi Grant Halverson, who's a psychologist. And I grabbed this a long time ago in an airport when I was traveling from a conference or something, called "No One Understands You and What to Do About It." I read the whole thing on the plane.
Wow.
And it's very relevant to this topic because it's all about these perceptual lenses. And so when it comes to, say, Paul's book about dressing well in medicine, you got to be able to separate what your individual desires are in such a way as to what the data shows. And if you want to be taken seriously in a professional environment, and if you want to be taken, and certainly in a medical profession, you've got to recognize that those first impressions, whether you're going to medical school, going to residency, how you're being interacted with on a day-to-day basis, those have long-term consequences. So why wouldn't you not make sure to take the steps needed to put forth that best first impression, to look the part of what it is that you are either are a physician or want to be if you're a medical student wanting to be a physician, and then if you have to do something on the side, do it on the side. But in these settings, make sure that you understand that perception is not just about how you want people to perceive, it's how they actually perceive you. And that has a lot less to do with what you want them to think, and a lot more with how you actually present yourself in how they perceive you.
Amen. I mean, that's pretty much the essence of what he was saying. If you want to be respected if you want to bring honor to the profession, of course, he has his opinions, but there's also the data to support what you were just saying about the way that, not just how you act, but what you wear. And it is hard to battle that once they already have their initial impression.
It's super hard. Like it's incredibly difficult. And like you mentioned about like first names and stuff, I still struggle with that. But I think I'm going to start, I'm already trying to change a little bit in some of my more professional interactions to be very clear that I am Dr. Cuccaro. I'm not Kevin Cuccaro in a professional setting. Because it's not just me anymore. There's a whole lot of other people, and there are some ramifications to that title, standard, role that you're in, environment that you're in. So it's not, it's not just you. It definitely is. It's a hard thing to, and you feel like you're trying to, well, I hope they're not taking me as an egotistical idiot, but it's not being an egotistical idiot. It's maintaining this, I wouldn't go to a bar or a party when it was totally relaxed and just say, oh, well, I'm Dr. Cuccaro. I'm Dr. Cuccaro. That's a totally different environment. But if you're in a professional setting, maintain that professional relationship.
Yeah. Well, I mean, I guess the question is if they respect you, respect the profession, and it's going to come from that individual too. I find it interesting that a lot of my coworkers, they call me Dr. Katie all the time. Maybe they just don't know my first name because they're so used to just calling me by my last name. But outside the work environment, when it's just casual conversation, they still have a hard time just calling me by my first name. There's a certain element of respect and habit and or lack of knowing my first name.
Or what was the first perception and encounter that they had with you? Was it professional?
Professional.
Yeah.
I mean, unless they're my own colleague, but I always tell people, I'm like, if I'm in front of a patient, I expect to be called Dr. Katie. I made the mistake of saying, another surgeon's last name without the doctor in front, and said this particular person was there, and you think I just like committed a crime. But some people, there are some ego-based reasons for that too, not just like feeling like respect. But when it's colleague to colleague, it's a little bit different. But it kind of just depends. If there's a conscious patient in front of you that is, gonna witness this interaction, it might be good to use the doctor in front of it. But I think everyone out there, if you're not a physician and you don't understand this, it is a struggle for us, because we want to be seen as who we are, because we sacrifice a lot of our life for that. But the point to this conversation is really about Paul and Dr. Paul Thomas. Who's discussing dressing well in medicine. And I think it's worthwhile listening to not just conversation, whether you're a physician or just curious individual, definitely people that are transitioning from medical student, trying to get into medical school or going into residency or trying to get their first job or whatnot, because I think people hiring you or selecting you that are in tune with this, or maybe they don't realize subconsciously how they're impacted by these various things. They're going to play into how far they play into it's hard to say, but I think they're going to play into how people are perceiving you, and whether you look the role or the part to be a physician, medical student, resident, fellow, or whatnot. So I think people just should go watch it. I mean, I don't want to rehash the whole episode in this episode, but
I think they should rewatch it. And then if you have any sort of questions about how to dress, and very specifically, I mean, there was a little piece that we talked about, just like suits. And if you buy a suit, some of the things that you need to pay attention to. And if you're a guy who doesn't wear a lot of suits, you're going to want to listen to that, and you may want to buy the book, because they're little signals, right? If you may think that's a normal thing, but if you come into an interview then and you're wearing the suit that you've never worn before, and you're thinking to make a great first impression, and the guy across from you is familiar with suits, which a lot of the old time physicians specifically are, they're going to go, oh, that tag's still there. Oh, he still has the tailor ties in. And that's something, you don't want that little distraction to interfere with you presenting your best self. Like, I mean, that's the whole goal about this, besides the presentation and in professionalism is the fact if you're in any sort of environment where you're introducing yourself and you are the new person and you're making those first impressions, how is it that you can get them to focus on you rather than any other little distracting variable? So there was one last piece that he briefly touched on was sprezzatura. And I like that, because some of the other arguments people would say as well, but how I dress is who I am. That's fine in certain roles, but if you're in it again, when you're trying to identify who you are, don't let that external distract from the internal. And that sprezzatura, little discussion in there, is super, super powerful, because it lets you express who you are, but in a way that accents that professional environment rather than distracts from that professional interaction. So I thought that was super cool, and I learned a new word out of it too. So that was even better.
Yeah. Well, and if anyone socially feels uncomfortable with interactions in these kind of environments, you're already going to have some level of anxiety, and you may not realize how you may be distracting the interviewer. So I think that's another reason to kind of try to do all the other little things so that you don't create a distraction for the interview that's about to take place. But yeah, I love that. I like the word. I'm gonna have to look, see how to spell that.
sprezzatura. I had to look up too.
Sprezzatura.
Yeah.
Yeah. It's I love it. I think there's I think it reminds you to pay attention to your surroundings or the environment you're walking into, to kind of bridge who you are with also trying to make sure you can connect without distraction with the interviewee or interviewer.
Absolutely.
Cool.
Yeah.
Well, cool. Any other last comments before you take us out?
No, other than super fun discussion. And if any of the listeners out there, you guys have a topic that you are really passionate about, and like, this sounds silly, I guarantee you that's probably a great discussion to have. And if you want to discuss it with us, you let us know. Just hit us at thechangedphysician.com. And until next time, stay well.
Take care.